You know, one of the wonderful things about this show is that we learn all kinds of different areas of medicine. And medicine is just jumping forward in leaps and bounds in a lot of the things that they do and finding out new things like, I didn't know what interventional radiology was. Well, you're going to find out today just like I am. And we're going to talk to Dr. Marshall Walker here with Singing River Health System. How are you?
I'm wonderful. Thank you for coming.
Well, thank you. Thank you for having it. Give us first a little background about yourself.
Kind of hard to believe, but I actually grew up in Ocean Springs. And I knew the man that actually sat in this office when I was a child. And now
Really?
I'm sitting in his office. His name is Dr. Jeff Sauls, and he's one of the people that kind of opened my eyes to what it was to be a doctor, and because I didn't know what doctors did, quite frankly. My father and my mother
Except for taking you to one.
Certainly. They discouraged me from being in medicine, and I beat them in the end.
Excuse me. Once you decided to get into medicine, was radiology something that you immediately wanted to get into, or did you start in another field?
I actually thought that I was going to be a radiologist, and then I lost my way in medical school. I became intrigued by orthopedic surgery, and then beat it out of myself. Got wise.
A little bit difference between orthopedic surgery and a radiologist. But being a radiologist, you said you're an interventional I mean, I thought a radiologist is just a radiologist. You do x-rays, things like that. But what is an interventional radiologist?
So radiology actually invented a lot of the things that you already know about.
Yes.
Everybody's heard of a heart cath. That was invented by radiology.
Really?
The cardiologists now do all of them because they're heart doctors, but the squirting contrast into arteries and things like that, that is a radiology procedure. Long ago, that was just part of diagnostic radiology. Now there's actually postgraduate training, fellowship training in other words, to do intervention, because it's not just taking pictures anymore, it's now delivering therapy. So not only do we take pictures of arteries and veins and the bile ducts and whatnot, but we also deliver therapy in some ways. So stenting them, stopping bleeding, both in the gastrointestinal tract and elsewhere, for trauma and for a number of other reasons. But also some of the more interesting developments are giving, say, chemotherapy directly to the blood vessels that feed tumors. So that's one thing that I do. And
so basically you're targeting it.
Exactly right.
You're targeting it because whereas used to if you had a tumor or something like that, it was just like you're going to bombard that whole area. But now you can target it.
Precisely right. Specifically in liver tumors. Not just primary liver tumors, but metastatic disease to the liver. We actually have a couple different options. One, you can just stop the blood supply to the tumor and hope for it to necrose. The other thing, we actually have microscopic beads that are now impregnated with chemotherapy that can be delivered directly into the tumor. That's an outpatient procedure. It sounds very involved, but it's really, the type of thing where you'd come in the morning and leave after lunchtime.
Wow. So are you seeing that more and more people are able to go through an outpatient type situation because of the how far radiology and interventional radiology has come?
Certainly. Most of these procedures are done through pinholes. Your artery or vein is accessed by a needle not much bigger than what you have blood drawn with. And then all of the equipment goes through a very small hole, and you have a Band-Aid at the end of the procedure.
Wow. That's almost like laparoscopic surgery.
Smaller than that.
Really?
Yeah.
This just goes right in there and takes care of it. And what are some of the different areas that an interventional radiologist attacks, so to speak? Well,
the way I view interventional radiology is not so much as a lone wolf specialty, but more as an assistant to the other specialties. Because as a radiologist, I'm a radiologist first.
Right.
And so interpreting the exams for the other specialists and the general practitioners is our main value. But interventional radiology gives us another way to help them.
Right.
So if someone has a problem with bleeding fibroids, the conventional way to treat that is to have a myomectomy or a removal of the fibroid, or to have a hysterectomy. That is a surgery where your abdomen and pelvis must be opened up. It can be done laparoscopically also, but that is a larger issue. So if you have compromised heart function or lung function, you might not be a great candidate to have surgery. I can help with that because I can go into the arteries that feed the fibroids and once again cut off the blood supply to the fibroids and shrink them down.
Wow.
That often decreases or eliminates the bleeding from fibroids. It certainly doesn't get rid of the fibroid like a hysterectomy does. But once again, for most women, a hysterectomy is fine, and they're going to be good candidates for it. But I can actually add, hopefully another option to those ladies that aren't such great candidates.
Wow. Now you have something here that you were showing me before we went on that had to do with the stomach area, I believe?
Sort of, yes.
The liver.
Yes, the liver and the veins of the gut.
Okay.
In people that have cirrhosis or really bad liver disease, often the blood pressure in the veins that drain the intestines is too high. And that can cause multiple problems, bleeding and death being things that can happen. But most of the time what happens is that people get enormous amounts of fluid building up in their abdomen that has to be drained periodically, which is unpleasant for them, hard to treat. So one of the things that interventional radiologists do is create what's called a TIPS. And a TIPS is an acronym for transjugular intrahepatic portosystemic shunt.
Sure it is.
Everybody prefers to say TIPS. But the TIPS can actually get too narrow and then cease serving their function.
Right.
I follow my patients, and in patients that have these things done, I like to see them. People often scoff at that because radiologists don't see patients. I see patients. And in this lady, her TIPS wasn't functioning quite well enough. She was still getting the fluid buildup, despite the fact that she'd had a procedure to make that stop happening. So what we did this morning actually is we went in and opened up the stent with a balloon catheter. Once again, people have heard of angioplasty.
Yeah, sure.
This is the same procedure. Open the stent up, and then this, which is a large abnormal vein, and this is the one that can bleed and cause the trouble. Afterwards, you see is gone. The blood is going into the stent where it belongs.
Wow, that's amazing. That's something. So, and you're the only interventional radiologist around here, from what I understand.
As far as I know.
And I guess they basically, a physician, general practitioner, would know if they need to send someone to a specialist if you're having some issues or whatever, that they may end up having to come see you.
Well, what I really like to do is kind of help problem solve, because once again, I view my role as sort of an assistant to everybody else. And I would, quite frankly, love to discuss cases with anybody, because if there's something I can do, I'd love to do it. But also, it's problem solving and kind of just putting information out there so they're thinking about options that they might not have been aware of. Is also, I kind of view my role, because I am the only interventional radiologist around here. A lot of people don't know what I do, so I wind up spending a lot of time on the telephone telling people what I do.
So you educate him. Dr. Walker, thank you so much.
You're very welcome.
Really interesting, really cool. Anyway, again, great knowing that you have someone like this. As I said, Singing River Health System prides themselves on having the top of the line technology and physicians that can make you healthier and better as your life goes along.